Hi, my name is Jessica Cabral. I'm a student in the distance learning program of Indiana State University BSNRN program. This is part of my community health nursing program. Before we continue, I'd like for you to take a moment to click on the link and take a short quiz. This will kind of let you and I know what it is that you know about this particular presentation that I'll. During this presentation, I hope that you gain some information about advanced care planning, which would entail the 4 types of advanced directives, end-of-life treatment, organ donation, and what a healthcare surrogate means. In Illinois, the law allows for you to make 4 types of advanced directives: a healthcare power of attorney, a living will, a mental health treatment preference declaration, and a DNR POLST. An advance directive is a written statement that you prepare that expresses how you want medical decisions made in case you're unable to make decisions for yourself when you don't have your mental health faculties. A healthcare power of attorney is somebody that you appoint that will make these decisions for you. A living will is another document that you can have that would help let doctors know how you want to be treated if you're dying or permanently unconscious, and can I make these decisions for yourself about emergency treatment. A mental health declaration is one of the other legal documents, and a DNR, which is a do not resuscitate, practitioner order of life-sustaining treatment. A healthcare power of attorney, which I just previously discussed, is somebody that you name in a legal document as your proxy or your representative when you're no longer able to make decisions for yourself when something happens to you. Other types of advanced care directives would be a living will, which would be in when death delaying procedures can be used. Excuse me. If you have a terminal condition and are unable to state your wishes, this is what we previously discussed. This only applies if you have a terminal condition. You can use a standard living will form or create your own. You have to also have 2 witnesses. A DNR is a do not resuscitate practitioner order for life-sustaining treatment, which would entail CPR, which is the cardiopulmonary resuscitation, cannot be used if your heart and or breathing stops. And the other type of advanced care directive is a mental health preference declaration, which lets you say if you want to receive ECT, which is electroconvulsive treatment, or psychotropic medicine when you have a mental illness and are unable to make these decisions for yourself. Your mental health preference declaration expires 3 years from the date you sign it. 2 people have to witness this, you signing, and the only people that you cannot have witness: healthcare professional, which is your primary care physician, an employee of the facility if you reside in a skilled nursing facility, rehab center, or treatment center, and the other person that you cannot have as a witness is a family member related by blood, marriage, or adoption. The other thing I want to talk about is organ donation. This is allows organs or body parts from a healthy person who has died to be transplanted into somebody who needs them. The most commonly used organs are the heart, the lungs, the pancreas, kidneys, corneas, liver, and skin. There's no age limit for organ and tissue donation. You can carry a card in your wallet, and typically this will be listed on your driver's license. The other thing I want to talk about is a brain donation is different from other organ donations because this is donated specifically to scientific research. So it's not, your brain's not going to go to another. Okay, what happens if you don't have any advanced care directives? Well, a healthcare surrogate would be appointed by 2 doctors. This can mean that your surrogate would be, in order of priority, respectively, would be a guardian. If you don't have a guardian, it would be your spouse. And if you're not married, it would be any adult children. If you don't have any children, it would be a parent. If your parents are no longer living, it would be any living brother, sister, or grandchildren, adult grandchildren. If you have none of those or any of those aforementioned people are unable to make these decisions for you, a close friend. If you don't have any close friends or they are unable to make decisions, a guardian of the state would be appointed. Remember, a healthcare surrogate cannot tell your healthcare professional or doctor to withdraw or withhold life-sustaining treatment unless you have a qualifying condition. And those would be one of these 3. A terminal condition, which would mean that you have an incurable or irreversible injury where there's no possible chance of cure or recovery. Death is imminent, and life-sustaining treatment would only prolong the dying process. Meaning, if you're on a ventilator that's helping you breathe and they stop the ventilator, that would be one. The second thing would be a permanent unconsciousness, which is if you're in a coma, there's no brain activity, there's no purposeful movement, and there's no sensory awareness. And providing life-sustaining treatment would only have minimal medical benefit, which is basically being brain dead. And 3 would be an incurable or irreversible condition, which there's no cure for recovery, there's no possible chance that you would return to yourself, that this would impose severe pain or inhumane burden on you, and that life-sustaining treatment would only have a minimal medical benefit. Also remember, any of these advanced care directives that we discuss are entirely your decision. Do not let anyone, or be it a professional, a doctor, who you think is a friend, impose their wishes on you. Before we part ways, I'd like for you to take a moment to click on the link and just kind of see what it is that you remember from our presentation. It's that short quiz that you took previous to the. For more information, I've listed a couple of websites here from the CDC and the Health, and these are some of my references. Thank you for taking the time.